It's time for our final talk of the day, which fittingly is Dr. Anne Child. With improved treatment for Marfan syndrome has come longevity of life, and people are living a normal lifespan whilst encountering new problems. So in this final fitting talk, Dr. Child discusses how to age well with Marfan syndrome.
Thank you very much. Well, I think Marfan syndrome is a great success story. When I first started in this field, the average age of death was 32, and now it's more like 68. So what's brought about this tremendous change? And I think it's research, really. With 30 years of research has come another 30 years of life. And this is a statement from Professor Reed Pieritz, who is the co-director of the Pennsylvania School of Medicine and a Marfan expert. And I love that phrase. 30 years of research means another 30 years of life. Patients over the age of 50 are increasing in number, and they're writing a new chapter. So what I'm presenting today are the results of a questionnaire survey of 50 patients over the age of 50, which many of you participated in a few years back. The cardiac problems are most important, and aortic dilatation is progressive. So, of course, lifelong surveillance at regular intervals, depending on what's shown on the last echo. You and the doctor can decide when you need a new one. Surgical repair for aortic root diameter has come down from 5 centimeters to about 4.5 centimeters, and even earlier for patients where it's being performed preventively, or if there is a high risk of early dissection in a family. The Paris procedure is a major success story and is now offered around the world in surgical units with the same mortality risk as the open heart surgery, and done much earlier, so that we aren't missing people who go beyond the best root diameter before we actually operate. Medication has improved, and with the help of our patients, we have performed a 5-year trial of irbesartan in the UK with 200 patients. And we showed that not only is it somewhat better than atenolol in that it has fewer side effects, but it can be used as well as atenolol. They have slightly different effects. So if someone has side effects to atenolol, then we can switch them to irbesartan, provided they're age 6 or over. Following surgery, of course, we recommend annual surveillance. You mustn't get lazy. And we have to remember that arrhythmia occurs in 40% of patients. And this has to be monitored with ECGs at the same time as the echo each year. This can be treated with medication or a pacemaker, which means that the pacemaker lasts at least 10 years without any care and provides a further life expectancy. The left ventricular failure risk is increased, but heart failure again can be treated. And this is due to a deficiency of fibrillin-1, the protein that is deficient in Marfan syndrome. It occurs in the left ventricle as elastic, helping to provide the pump. Antibiotic prophylaxis is recommended for dental extraction and for surgery where blood is mixing with tissues like intestine to reduce the risk of infective endocarditis. This is where germs enter the body and circulate round until they find a slightly floppy valve and they land on it. It has extra folds and they say, oh, this is nice. We're nice and warm. We're being brought our food. I think we'll stay here and just multiply. And once it's taken over and is in place, it's very difficult to eradicate. So antibiotic prophylaxis, where you take antibiotics an hour before and an hour after dental or other surgery, can help to reduce the risk of heart infection. If you're having anesthetic for any operation, then we suggest a preoperative chest X-ray, ECG, and echo. And anesthetists are specialized nowadays. You can ask for a cardiac anesthetist who will know about Marfan syndrome and keep arrhythmias and blood pressure under control. We've heard from Simon and Professor Aziz, and that figure should be 40% of people with Marfan syndrome have irritable bowel syndrome. It's double the population risk of 20%, so 40%. And this can appear in middle age, and it can be very puzzling. Treatment with medication to enhance the movement of food through the bowel, and dietary advice to add bulking agents or high fiber foods, and avoid food intolerance such as lactose in cow's milk, substituting soy or oat can be very helpful. Gluten is often the culprit, and this is found in wheat and wheat products. So corn and rice can be substituted for gluten. Respiratory disease may catch up with you if you live a long life. So at no time should patients smoke, because the incidence of lung trouble is high in Marfan syndrome. This is because there's a lot of fibrillin in the lungs. Obviously, they're elastic. Every time we breathe, they expand, and the incidence of little balloons or broken down walls within the lung, called bronchiectasis, is high. And obstructive pulmonary disease increases. So don't smoke, not even vaping. We often hear from patients over 50 that they suddenly get very tired and they can't do their job. One of my patients was a school principal, and he said, by the time I get up to the second floor, far wing, if there's a problem student in the class, it's too late for me to be of any help. So we wrote to his insurance company and we discussed the pensions, and we managed to obtain for him early retirement on grounds of ill health, simply because fatigue is part of Marfan syndrome. And we can often write a letter of support to encourage the employer to realize that this is a truth. It's reported by many of our patients. So how do we solve this problem? Suggestions from the patients are that you live close to your work so that you don't have to spend a lot of tiring time traveling, that you ask for a parking position at work, or failing that, that you work part-time or from home. And increasingly, this is the solution. We are quite happy to write letters of explanation and support so that patients can take these to their retirement or their supervisors' meetings. And we just tell them this is the truth. The patient is tired. Traveling. We often have young people who want to go around the world, or older people who just want to travel. And we write a letter describing their cardiac status with the aortic root diameter, if the surgeon hasn't already provided it, or the cardiologist. But I always encourage them to find out where the nearest large center of medical and surgical excellence is. In other words, don't go snorkeling in a part of Egypt which has access by a bumpy road and a jeep 2 days away, if you're at risk of possibly needing help for aortic dilatation or heart failure. And specialist travel insurance companies, this is especially true for the younger people, we have written them into our guide for young people. But if you look in magazines on the weekend, you'll find specialist companies that say, we will insure you, your medical history is not important. Also, the BHF, the British Heart Foundation, can recommend certain travel insurance companies. Bone and joint problems. Now, these can dog us at any time, but in Marfan syndrome, these tend to occur 5 or 10 years earlier in older age than in the general population. The joint pains may increase, and treatment is available. You just have to ring the changes till you find a medication that works for you. The NSAIDs can start with the milder ones like aspirin and go up through naproxen, and then settle on, I think the most powerful is Brufen or ibuprofen. You can buy it over the counter as low dose tablets. And if you find they work after a week, go to your GP and ask for a prescription, and you may need a stronger prescription. Joint and arch supports can be bought online, but the arch supports tend to be made best by a podiatrist who can look at your own particular shoe and your own particular foot and devise a particular arch support. Where do you need it? Do you have plantar fasciitis? Do you need a slightly raised heel? Do you have flat toes? And so forth. And they can put little pads in wherever you need them. Obviously, we have to maintain fitness any way you can. And Dr. Gatti has already explained, we want low impact sports, such as the following: swimming and walking, badminton, golf if you've got a good back. But the actual twisting action in golf is apparently not very good for the aorta. So perhaps just walking. Next. So as general advice, treatment is available for all aspects, and it's improving yearly through research. Coping with old age, if you've got a familial Marfan syndrome, can provide a positive role model for younger affected family members, your children, your grandchildren. If they can see that grandma is getting along fine, or if she isn't, how she's coping, they're learning. GPs must not blame everything on Marfan syndrome. Quite often you go with an ache or a pain, and the GP says, oh, it must be your Marfan syndrome. But please remember that patients deserve investigation just as any other patient. You mustn't be fobbed off by saying, oh, well, I guess it's part of Marfan syndrome, you'll just have to put up with it. And lastly, patients over 50 are pioneers helping us write a new chapter in the natural history of Marfan syndrome. And the average age and the general quality of life are improving every year. So I think we have a bright future. So I hope that that's some good advice, and that's taken from yourselves and people like you. When we ask them, we now have a new group of patients over 50. Can you help us know what to expect so that we can teach others? Those are the answers that came back. Thank you very much. Does anyone have anything to add? Or ask? And if you do, certainly let us know, because we're continuing to update our chapters on older age and Marfan syndrome.
Hello, Dr. Anchild. This is Mariam. I just wanted to basically ask you, my father, who also has Marfan syndrome too, and has heart condition as well. The thing is, the doctors have not, he needs to be treated for his heart condition, and his GP and hospital is not basically referring him to any hospital for him to be seen. So I'm just wondering, what would you suggest I do? Like, how can we support him? He's in his 70s now, and he's struggling with his health. What would you suggest I do? Who do I contact to get him seen by the hospital? Thank you.
That's a very good question. Certainly, heart failure clinics have sprung up all over England because there's so many patients growing older now and developing heart failure that they've been given special clinics, specially trained doctors. So really, you need, if your GP won't listen, you'll need to find another GP. We're happy to write a letter sending our literature about heart complications in Marfan syndrome. But you must remember that in the NHS, you can always self-refer if you're desperate. If you write a very nice letter with your medical history and send it to the cardiac department of your local hospital, and ask if you can please be seen in the heart failure clinic. If you are a patient at the hospital already, you can enclose your hospital number. That makes things much easier. But as I say, don't be fobbed off. If you've got symptoms, then you can be treated.
Thank you so much, Doctor. I really appreciate your help and support over the years. My family really, really appreciate all the support you've given us over the years. And my mum always prays for you. She's always praying for you. You know, she had a wonderful experience with all your help and support. Thank you.
Well, you're very welcome. A lot of doctors don't know about Marfan, so that's where our literature comes in handy. If we send it to you, you can send it on to your doctor or take it and leave it with them.
Please. That would be really appreciated. Definitely. Thank you.
Good. Welcome.
Gareth wonders if the gallbladder is at increased risk of rupturing with Marfan with a single large gallstone.
That's a good question. I have never heard of a patient with Marfan who has gallbladder problems. Now that's interesting. They also don't seem to have increased cholesterol. They seem to be an atherosclerosis-free model, which means that although they might die of an aortic dissection, their arteries are clean as a whistle. So that's interesting. I think the answer is no.
Good. And Salma's hand is raised. Salma?
Hello, everybody. Just want to say thank you very much for this very enlightening day, very informative. It's my first time I actually ever partake in something to do with Marfan's, but I am trying to learn more about it. My mother had Marfan's, but she did not know about it until she had 3 of her 4 children, and 3 of the 4 have Marfan's, me myself being one of them. So I was actually part of the AIMS trial. So I am currently, so it was something that I was very sort of excited to be part of. So what I want to do, I mean, by the time my mom found out, I mean, most of her symptoms had settled in and she's had to have a replacement valve and such. So I'm trying to prevent, deterioration as much as possible. So in addition to sort of exercise and, the general advice, what can we do to sort of like help with the connective tissues? I mean, I read a lot about like collagen supplements. Does that help, or is it just not worth it, really?
That's another good question. I think keeping your blood pressure normal is very important. That's the whole basis of treatment for Marfan syndrome, really, is dropping the blood pressure to relieve the pressure on the arch as the heart pumps. So I would measure your blood pressure regularly, go along to see your doctor. Keep your weight down, less work for the heart to do. Exercise regularly. As far as medications go, there's no medicine to actually strengthen fibrillin as yet. We do find that the patients on irbesartan the children from 6 to 16, when the aorta is actually growing rapidly, did best, rather than the older patients whose aortas had already been formed. So that's interesting. Perhaps irbesartan is good for all of us, but especially for the children when they're growing. It seems to preserve fibrillin. What about collagen? Well, if connective tissue is made up of about 46 different proteins, and they form bundles that run in all directions. You know, they look like this. So no matter how you pull on your skin, there's something there lined up to take that pressure. If one of those proteins is missing, the others can substitute to a certain extent. So if you think rationally, if I keep my collagen strong, then my tissues will be stronger. Now you can help collagen with vitamin C. It helps with repair, it helps with maintenance. It's a necessary cofactor, and it can't do any harm as long as you take it in doses up to 1,000 grams a day. There's no use taking anything more than 1,000 grams a day. It just passes out in the urine. But while you're at that, you might as well add the other cofactors which are necessary for collagen production. And they're calcium and magnesium and manganese. So I think it doesn't do any harm to take one a day multivitamin, which will have vitamin C in it, as well as those other cofactors, as long as you don't overdose. I think it's probably a good idea. It's not proven scientifically, but since we don't have any specific medicine, I think perhaps that might help. But I wouldn't take a lot of collagen. It's very expensive. Some people take it for their joints. And I say, fine, try it. If it doesn't help after a couple of weeks, it's not going to. Save your money. Because basically when you eat collagen, it's broken down in the stomach, and then it has to be built up again into new collagen. But you don't have to take collagen to make collagen. You know, you'll be getting it in meat, even jelly. Any good protein will provide the elements for collagen. So don't spend a lot of money on anything, but the multivitamins are cheap.
Thank you very much.
Paul wonders if there are special considerations for bronchitis and Marfan syndrome.
That's a good question. I think patients with Marfan syndrome are prone to ear, nose, and throat infections simply because the tissues are soft and don't localize infections. And that would hold for bronchitis as well. But unless you're actually producing green or yellow sputum from somewhere, I don't think it's worth antibiotics. But avoid smoking, keep up your fluids, and try and get out in the sun and get, you know, vitamin D, and take a diet, it's high in vitamins, and that should all help the healing. Other than that, you could consult a respiratory physician and see if there are any more suggestions. Sometimes it has an allergic component, and then you could take Puriton or the less drowsy making version of Puriton, and check your foods. But basically, I think just avoid crowds, get your injections for COVID and flu, and don't smoke.
And Gareth wonders if bilateral inguinal hernias are possibly more common in Marfan patients than in the general population.
Definitely, yes, because the connective tissue in the abdominal wall that holds the intestine in is weaker, the ligaments and tendons. Fibrillin is especially found in ligaments and tendons and where they attach to bone. So ligament strains and sprains and tears, and you know, soft abdominal wall, which allows the intestine to escape through a hernia orifice are all more common. Yes, he's quite right.
And Anne wonders if candesartan is as beneficial.
No, is Nitha still with us? That's a question for a cardiologist. I think all the sartans are much of a muchness, really. You just have to find one that agrees with you, because a lot of people can't take sartans. Oh, if I can nip back to that hernia question, if you say to the doctor, I have Marfan syndrome, could you please use a mesh? Sometimes people have recurrent hernias. So the first time they're repairing it, if they put in a mesh, that prevents it recurring. They put it just under the skin to reinforce the tissues. Right. Well, perhaps we should, oh, last one maybe?
Because the bowel is floppy, are we more at risk of a twisted bowel?
Yes, volvulus. It's quite rare, but it does happen.